Hello, I'm Professor Shane Darke of the National Drug and Alcohol Research Centre at the University of New South Wales, and welcome to a new lecture in our series, Drugs and the Body. Now, today we're doing a topic that there's been increasing interest in terms of the use of these substances and the harms associated with them. That is the volatile inhalants. Now, these are known by many names, volatile solvents, slang terms such as chroming, huffing, nangs for nitrous oxide, poppers for amyl nitrate. I think, broadly speaking, we never want to glamorise these substances, and the correct term is volatile inhalants. So what are they? Basically, they're substances that vaporise at room temperature, and they're inhaled for two main reasons: intoxication and, less commonly, but also sexual enhancement. These two are the main thing. Primarily, I would suggest for intoxication. These substances, what makes them different from many of the other substances we discuss in this series, is that they have common industrial and commercial purposes. They're common household products in many cases that are completely independent of their effects, their psychotropic effects, that is, their effects upon people's mind and experience. This, of course, presents us with a range of difficulties in terms of controlling the harms associated with these that are less obvious for drugs such as heroin. How commonly used are they? Well, it varies by age group. Population-wise, it's up to about 2% of a population will have used these drugs. It's far higher amongst younger people, particularly people like school age or early university years. But I should point out there's been a trend that's been documented in this country, Australia, but also in countries such as the United Kingdom and the United States, for more older people to be using these. People who are aged 40 or more. They may have been using these for a long time, we do not know, or they may have started using these in later life when other drugs became more difficult or too expensive for the people to use. So when we look at the harms, I would ask you to bear in mind we're not always speaking about children or young adults. Now, there are a bewildering array of products that fall under this general category, but I think we can put them into several major groups that I think would help people and us as researchers and clinicians to understand what we're dealing with. The first category is gas fuels. Those are things like, obviously that's fuels in gas form. I'm thinking of cigarette lighter fluid or barbecue canisters, substances such as butane, essentially. The second group related to this, obviously, is petroleum or gasoline. Obviously that's vehicle fuel, so it's liquid fuel. And what this is, the way this is used is petrol is put in a can and is then sniffed. The third group are what we call aerosol propellants. They're contained in common household spray products like air fresheners or deodorants. Again, with all of these, the substance is inhaled, it vaporises. Adhesives and paints, I'm thinking of here like things like glues, spray can paints. This is where, of course, with chrome, the term chroming comes from. And of course, I'm sure many of watching this will be well aware that glue sniffing has been a problem, particularly amongst younger people, for many decades. One area that is particularly relevant at the moment are the volatile anaesthetics. These are essentially what we're talking about here is nitrous oxide in relation to this. It's used in dentistry as an anaesthetic, And I should point out when it's used mixed with oxygen. We'll get back to this. More commonly, it's used in little 2-gram canisters that are used for whipped cream dispensers. And those other little canisters that frequently around the world are called nangs. Although increasingly we're seeing in Europe 2-kilogram bottles being used and with a mask attached, and this is particularly high-risk behaviour. Finally, there's the nitrites, and particularly amyl nitrite. That's used for the treatment of angina, but it's used predominantly for sexual enhancement. It's the so-called poppers. Well, now that we've explored what these substances are, the obvious question is, can you become dependent upon these? I suspect that there's a general view that common household products are harmless or relatively harmless and not associated with dependence. Nothing could be further from the truth. There is a recognised dependence syndrome, as we see for other drugs or substances that people use for intoxication. Any substance you can use for intoxication will have a dependence syndrome. Drugs that change people's perceptions or mood states are reinforcing, and it will be an associated dependence syndrome, which may have greater or lesser probability depending on the substance. It's estimated about 0.5% of the population meet the criteria for inhalant use disorder. Now, one thing I should point out is that there's no recognised withdrawal syndrome. This is different than a drug such as alcohol or heroin, where there's clear withdrawal syndrome. It's not actually part of the criteria for dependence. What you're seeing with the dependence is uncontrolled use, increasing use, use despite harms, and an inability to stop. In such cases, I should point out, you may take a person into a detoxification unit or to some unit for treating their dependence, but it won't be to detoxify them, it'll be to take them away from the source of the drug. So if someone's sniffing petrol uncontrollably and taking them out of that environment. The other thing I will show you just about petrol, because it's something we should keep in mind in possible solutions to these problems, that is that low aromatic fuels have been produced in recent years and in Australia have been used in areas where there's been high rates of petrol sniffing. That has had the effect of reducing petrol sniffing because this type of petrol, you cannot really become intoxicated on it. There becomes no point. That's an example of how we can deal with a common product, and it may have implications for other substances. All right, we've explored what these substances are and their dependence potential. Let's have a look at the physical harms. Firstly, let's briefly look at toxicity. These drugs are toxic. The idea that just because it's a household product, it's harmless, is one that needs to be confronted and defeated. Nothing could be further from reality. The physical symptoms of an acute toxic reactions to these substances, cardiac arrhythmias. We see this across a range of other drugs, but this is a major thing. That is, the rhythm of the heart is disrupted. This can result in cardiac arrest, a heart attack. They also are associated with respiratory arrest. That is, the respiratory system can just shut down. We used to think that all of these, particularly deaths, were associated with cardiac arrest, but it's been shown that there are cases where it's clearly the respiratory system has just shut down and the person has died or nearly died. They can also induce seizures and fits. These are all obviously clinically significant effects of these drugs, and if these are occurring, medical assistance is urgent and essential. Call for an ambulance if you're there in the presence of people experiencing these symptoms, signs and symptoms. There are, of course, behavioural aspects. One of the things we can see is what we call an agitated delirium. We've seen this with drugs such as methamphetamine. The person becomes delirious, they're highly agitated, they're virtually uncontrollable, running around, putting themselves and others in danger. And of course they can be so active they can actually experience a cardiac event and collapse. Ataxia, that is uncoordinated movements. The person is just completely unable to walk or move properly. And hallucinations. Hallucinosis is part of this syndrome, and again, if someone's hallucinating, they're agitated, they're a risk to themselves and they're a potential risk to other people. We've looked at toxicity. Let's look more broadly now at mortality. People do die from using these drugs, and I and my colleagues have been involved in documenting such cases in the Australian setting. What are the major causes of death? Well, we've touched upon some with the toxicity: cardiac arrest, heart attack, an acute respiratory arrest. Again, the person stops breathing, their breathing just mechanisms shut down. Asphyxia. Now you might think, well, that respiratory arrest. It's something slightly different here. What you're seeing are people who use these substances and they have a mask on, for example, to inhale a gas, and there's nothing, they pass out and there's no oxygen. They've got a non-respirable gas and that's all they're breathing in, and they can die from asphyxia. And we see cases of plastic bag asphyxia where people have put substance, like sprayed a substance into a plastic bag, they pass out and the bag's over their face and they die. And of course, people can aspirate, they vomit and then asphyxiate that way. If you think of a drug such as nitrous oxide used in, as an anaesthetic, it will be mixed with oxygen. You are not giving a patient just pure gas because they need to have oxygen to live. And cases where people hook themselves up to a large-scale tank with a mask on on their face is a recipe for asphyxia. People become unconscious and they asphyxiate. Suicide, we've seen clear cases where people, this goes back to we talked about agitation, that people can have these quite unpremeditated suicides that occur shortly after having taken a drug such as inhaled a gas and then behave in a very peculiar way, are agitated and then, for instance, just go and hang themselves and no one expected it. It's another form of intoxicated suicide, and that suicide may well not have occurred if that person hadn't been using these substances. And of course, traumatic injury. Many cases of people take these substances, drive, fall from heights. You're highly intoxicated. If you're uncoordinated or you simply pass out, you can have an injury that can cause serious damage and possibly death in the case of what we're speaking of. Hydrocarbons such as sniffing the fuels are in particular associated with a syndrome called sudden sniffing death. I've read cases of this that have occurred in the Australian setting. It's well documented. It's characterised by a sudden collapse shortly after inhaling the fuel. It's due to either cardiac or respiratory arrest. Basically, the person inhales it and passes out or drops dead. Again, if this happens, it's not just the person, it's not just, they'll get better. They could well be dying and you need an ambulance. Whenever people pass out, it's dangerous. And interestingly, with all of the substances we've talked about, but obviously with hydrocarbons, death does appear to occur. When death occurs, it appears to be quite rapid. We see far lower rates of pneumonia amongst cases of death, which Pneumonia takes time to develop, so you see more of it with slower deaths like some of the opioids. These people appear, they're in acute risk, which just their risk of dying could be immediate. And there's only one answer: if someone collapses, call an ambulance, call it now. Do not be hesitating about will we get in trouble or anything. This person is potentially dying. Let's start looking at some of the major organ systems, starting with the heart. We've already talked briefly upon this, but there are acute effects upon the heart from using these substances. As I've said, an arrhythmia, that is the rhythm of the heart, the rhythm of the heart is disrupted. Cardiac arrest can follow. That can be sudden, and low hypertension, low blood pressure. They're acute effects. Long-term effects are cardiomyopathy, that is the ventricles of the heart expand, the heart loses tone, shall we say, and its pumping efficiency is reduced. Cardiomegaly, which is increased size of the heart, that is again, you have a problem that the pumping efficiency of the heart is reduced. Now, if you think about these things, if you've got an enlarged heart and dilated ventricles in the heart, it's under stress, it's not performing well, and you use drugs that cause things like arrhythmias, the more damage you're doing to the heart, the more likely you are to have an event in the future when you use these substances. We'll now look at the brain. Again, there are acute and chronic effects of using these substances. An acute effect is cerebral edema, that is swollen brain. This is highly dangerous and can result in death. And seizures, fits, as we've previously discussed. These are acute effects, and again, if someone is comatose or they're showing seizure activity, do not just let them be there to recover by themselves, because they need urgent medical attention. But there are chronic effects from using constantly. One is cerebral atrophy, that is basically damage to the core of the brain, the brain itself. Cerebellar atrophy, that is the damage to the cerebellum. It has many effects, but one of the major effects is that it leads to discoordinated movement, and people will be uncoordinated, and that may be permanent. And we see this with alcohol, and it is a similar thing here. These substances actually do cause damage to the brain structures. Not surprisingly, we can see therefore impaired memory is one of the complaints of people with long-term use, and then they've got good reason to note that. And finally, there's something with nitrous oxide, or so-called laughing gas, that people should be aware of, that it's actually associated with spinal cord damage. Nitrous oxide impairs the ability to metabolise vitamin B12. This leads to damage of the spinal cord and ability to coordinate and walk. This, if left untreated, may be permanent damage. At the very least, people who are regularly using these drugs and are showing these signs would need medical attention, probably vitamin B12 being administered to them to try and reverse some of this deficit. Let's have a look at the lungs now. We've already mentioned acute respiratory arrest. The entire respiration system shuts down. But as we see with a great many drugs, aspirating vomit, those people they vomit, particularly if they're laying on their back, they inhale the vomit, and this can lead to pneumonia, and it can lead to death. Finally, in chronic users, remember these are drugs that are inhaled. There is evidence that long-time users have an increased risk of developing emphysema. So clearly there's a range of reasons why we should be concerned about the pulmonary health of users of these drugs. Let's quickly look at the liver and the kidneys. I think we can say, in having now moved on to these, that it's becoming clear these are not harmless products and that they affect a whole range of organs. In the liver, there's good evidence of liver necrosis, that is death of liver cells, and cirrhosis, that is the liver becomes completely fibrous and scarred and is no longer able to function. The kidneys, there's some acute effects there that we can see: acute inflammation, that is nephritis of the kidney, acute injury to the kidneys, and acute kidney failure. So what we can see is using these substances can result in major impairment of kidney functioning. Again, we're talking here of something that needs urgent medical attention. We've looked at a range of body systems. Let's look briefly at mental health. We know that regular users of these substances have higher rates of depression, and I will point out again, because I think it's important, that impulsive suicide whilst intoxicated with inhalants, that is, there's no history of suicidality, and it seems that the sudden event is related solely to a bad reaction in intoxication. I've noted with other drugs such as the stimulants, there is no question that these are cause related, that is, the person intoxication, delirium, their agitation may lead to a sudden decision to attempt suicide. It's also associated, these drugs, with acute psychosis. I've mentioned the agitated delirium. These two are obviously strongly associated. That this acute psychotic state can be paranoia, hallucinations, and an agitation. So, all in all, when someone's highly intoxicated with these substances, there is the chance that they could develop severe acute mental health reactions whilst intoxicated. Finally, there are some other more general conditions that are associated with the use of these substances. Macular degeneration in the eye. People may not be aware of that, and of course that has obvious effects upon vision and the ability to focus. Rhabdomyolysis, that is crush syndrome. People they pass out, they lay on an arm or a leg for an extended period of time, leading muscle breakdown, which causes damage to the muscle, obviously, but it also releases toxins that can cause injuries to other organ systems. And again, I'll just emphasise again, traumatic accidents. Obviously, anyone who's intoxicated really is at an increased risk of a traumatic accident if they're out doing things. But falls, operating machinery, driving cars. I know we all think probably everyone knows driving with alcohol on board is dangerous if intoxicated. Probably people need to be aware that just because this is a household product does not mean it's safe to use and go driving. For the reasons that I've elucidated throughout this lecture, people can be severely, acutely impaired while they're intoxicated with these substances, and therefore at increased risk of injury. Well, that really is all of it I have to present today on that particular group of substances. I would like the viewer to come away with the understanding that these are not harmless. They all have potentially dangerous side effects, and we need to be aware of that in determining how we treat these people that use such substances, and also can we do anything from the policy perspective to reduce use of these drugs. The work that's contained in the series of lectures on drugs in the body is contained in the Pocket Guide to Drugs and Health. But what I would like to say is that in 2024 we'll be releasing a revised version which will include a chapter on the volatile inhalants. This is all page at a glance, reference-free information on each of the major substances and the effects they have on the body.